Hello, everyone. I'm Angela Gentile with the Beaver County Office on Aging. Today, I'm at a quaint coffee shop, our hallowed grounds in New Brighton, Pennsylvania. The Beaver County Office on Aging provides information and services to people age 60 and over all throughout our county. Each month, our office gets hundreds of telephone calls about everything imaginable. But one of the most asked things that we get questions about are on Medicare, medical assistance, and medical insurance, and what to do about all that. I'm here today with a prize volunteer, Kathy Miller, and she's going to explain some of the most common questions our agency receives about health insurance. Welcome, Kathy.
Thank you for having us.
Thanks for coming. So tell us, when should somebody sign up for Medicare?
That's a good question. People confuse Social Security with Medicare, and they're two different things. A lot of people start Social Security at age 62. That is not the case for Medicare. Most people cannot start Medicare until they're age 65. And the best time to sign up, there's a 7-month window. It's the 3 months prior to your 65th birthday, your 65th birthday month, and the 3 months after. That's the best time to sign up to ensure that there's no gap in coverage.
So I'm mentioning this word, a prize. Explain to people what is a prize and what's in a prize volunteer and what does the program do for older adults?
A prize is a program that helps older adults navigate the Medicare system. It's a very complex system. There's different parts to it. There's probably 30 to 40 different plans you can choose from, more in some cases. So you need to understand the difference of which plans best meet your needs. A prize counselor is also walking through any additional help that you may get. If you're having trouble paying your prescriptions, there's programs available to assist you in that. There's programs to help you plan for long-term care. So a prize can sit down with you and look at your individual needs. It's all confidential. There's no cost, and they can go over everything with you and help you better understand which programs will work the best for you.
Okay. There's a program called Extra Help. That's kind of simply a simple term to use. Explain what that means.
You're right, it is. Extra Help, that's exactly what it means. Extra Help is a program that pertains only to help with prescription drugs, and it's directly through Medicare. And there are, you can only have so much income, and you can only have so much in assets to qualify for this program. And if you do qualify for the program, it's a great help with your prescription drugs. So when it comes to Extra Help, a single person cannot have a yearly income of more than $18,200 a year, and they can't have resources of more than $14,100 a year. And it's a little higher, of course, for a married couple. So if you're a married couple, the income is $14,690, and the asset limit is $28,150. Now, when they look at those resources you have, they don't count your house against you, and they don't count one vehicle against you. So if you have any questions and you think you may qualify, you should come in and sit down with an apprised counselor, and they can determine whether or not you qualify for that program.
All right, that sounds great. Now, one of the biggest things people are concerned, doesn't matter if they're younger or they're older, prescription drug coverage. Drugs are expensive, they're something that's necessary. What's available for older adults?
Drugs are one of the things that hurt seniors the most because they are so expensive, and as you get older you tend to take more drugs, so your costs become much and much higher. So Pennsylvania is funded by the lottery, and it's called PACE. PACE is the first program, PACE-NET is the second. PACE will cover a little more of your drug coverage. PACE-NET will cover a little less just because your income is higher and they figure you can pay a little more. So let me review the income for those. So if you are single, you can have an income up to $14,500 for PACE and up to $17,700 if you are married. Now for PACE-NET, it's a little higher and you get a little less, like I said. It's $23,500 annually in income and $35,500 annually for a couple. So the first number, $23,500, is if you're single. The second is $35,500, that's for a couple.
Now, we do know that Medicare covers a lot of basic things, doctor's appointments, maybe some medical tests and x-rays. People have to plan for things that maybe aren't covered when they're thinking they need other insurances to cover things. So explain to us some of the things that Medicare doesn't cover.
This is very confusing for people, and for some people it really doesn't make sense because, you know, our eyes and hearing are very important. But Medicare does not cover a lot of things in those areas. It doesn't cover hearing aids. It doesn't cover dental. It doesn't cover exams related to getting eyeglasses. It doesn't cover acupuncture, any kind of cosmetic surgery it will not cover. So there are a group of things that it just will not cover. It's not covered by Medicare. However, you might have a plan that will give you a little bit of coverage for certain things, especially the most common ones are eye and hearing sometimes, or dental. But those are very limited amounts. So it's important to understand what your plan offers, so you take advantage of that, but you need to understand overall Medicare does not cover those items.
Now, you know, in the course of a lifetime, sometimes people have their Medicare card in their wallet, maybe it's in a drawer or a pocket. Before long, it's gone, misplaced, missing. How do people get their card replaced?
Oh, sure. First, I'd like to say that most people in Pennsylvania should have gotten a new Medicare card in the last year. Social Security did away with attaching Medicare to your Social Security number to prevent identity theft. So everybody has a new number, and it's a random number, and it's unique to the individual. And that is your gateway to your Medicare. So you really need a copy of that card. So if you lose it, or if someone gets stolen, or it gets ripped up or something like that, there is an easy way to replace it. You have three options. You can call Social Security, and that number is 800-772-1213, or you can go online and apply for a new card. That's www.socialsecurity.gov. And your third option is to visit your local Social Security office. They'll be happy to help you replace that card.
Oh, well, that doesn't sound too bad. It's probably pretty comforting when someone loses a card. That causes a little bit of stress.
Right.
And tell us how to get a hold of the Apprise volunteers and the staff at the Office on Aging if you need some assistance.
Apprise services are all free, and they're confidential, and they are tailored to meet your individual needs. So the Beaver County office is located at 1020 8th Avenue in Beaver Falls. It's right across from the post office there. So you can call and make an appointment, and they'll be happy to set an appointment for you. And the number for the Beaver Falls office is 724-847-2262. So we'd be happy to have people call so we can sit down with them and review Medicare.
Well, thank you for all your information. That was wonderful. I'd like to thank Kathy Miller, our Office on Aging Apprise volunteer, for explaining so many of those questions that you asked us month after month. And we're willing to answer those questions so you understand your coverage. If you need to look to review some of this information, in the May edition of the Beaver County Senior News, we will have this question and answer format on all these questions on Medicare and the Apprise program. I'm Angela Gentile of the Beaver County Office on Aging. Thanks for joining us to our premiere edition of our YouTube videos. We'll be back with more. Thanks.